pulmonary edema or pulmonary congestion. This disease is divided into two types: cardiogenic and non-cardiogenic pulmonary edema. In non-cardiogenic type, the causative factors are extra to the cardiac pathology, in which there is high altitude pulmonary edema, there is headache, lightheadedness, dizziness, fatigue symptoms, cyanosis, cold and clammy skin. Drug-induced or toxic effect of the various drugs like heroin, morphine, aspirin. These produces damage to the capillary walls and the walls of the air sacs called as alveoli, due to which the exchange of gas mechanism is disturbed and oxygen concentration in arterial blood is reduced, which is not sufficient for the normal activity of the human body. Excessive use of alcohol, tobacco smoking produces also pulmonary failure and other toxic effect to the vital organs like brain, liver, kidney, because in smoke of the tobacco there are thousands chemical factors which produces pathologies in the human body and mostly in the lungs. Aspiration pneumonia, infection due to the invasion of the bacteria, virus, parasites which gets entry in the body, produces inflammation in the upper, lower respiratory tract and the alveoli, which also produces and accelerate the process of edema. The pathophysiology is the edema is produced by the increase in hydrostatic pressure in the capillaries, pulmonary capillaries, which are present in the interstitial tissues of the lung, due to which the fluid, including plasma, passes through the walls of the capillaries into the interstitial and the air sacs. And air sacs are filled up with the fluid, and they are unable to perform the duty of exchange of gases, the exit of carbon dioxide and entry of the oxygen via air sacs and capillaries into the arterial blood. Hypertension, diabetes mellitus, nephrotic syndromes, they are all contribute to this disease, that is production of the pulmonary edema. Now, the prevention and the management of the pulmonary edema. In acute pulmonary edema, which is a medical emergency, that is oxygen supplementation is utmost required, and shifting of the patient into the hospital is the utmost and the primary steps, and the oxygen is administered transnasal route or the face mask. But if the stage is very critical, then artificial ventilation is provided by the ventilators. The causes of the disease should be treated accordingly. To reduce the fluid overload, we administer Lasix injections, tablets, and also injection or the tablets dexamethasone to reduce the inflammatory process or inflammation in the walls of the air sacs and the capillaries. Because the walls of the capillaries are damaged by these factors, due to which the permeability is increased and the fluid passes through the walls of the capillaries into the interstitial tissue and the air sacs, which produces pulmonary congestion or pulmonary edema. Now, to maintain the oncotic pressure, because oncotic pressure is reduced due to the low level of protein in the arterial blood, especially the pulmonary arteries and the capillaries. So due to this lowering of the oncotic pressure, the fluid passes through the walls of the capillaries into the interstitial and the air sacs and produces edema, that is excessive accumulation of the fluid in the air sacs are called as edema. Now the difference between the pulmonary edema and pleural effusion. Pleural effusion is the accumulation of fluid in the pleural sac which is covering the lungs. That is, it is outside the lung parenchyma, while pulmonary edema is within the tissues of the lungs, in the air sacs and the interstitial tissues. The fluid is engorged and accumulated. Moreover, we have to maintain the normal blood pressure. If there is hypertension, then we have to use antihypertensive medicines to lower the blood pressure. Similarly, to reduce the fluid overload, we used various diuretics. In addition to this, there is administration of sildenafil and nitroglycerin, nitrite groups, orally or intravenously. They produces vasodilation and also reduces the production of the pulmonary edema. In addition to these medical factors, we have to pay attention to the patient's food and nutrition, provision of the vegetables, fruit, whole grains, cholesterol-free diet, and the necessary vitamins and minerals they are provided in the food stuff. Light exercise, aerobic exercise, regular one, is also necessary to reduce the acute or chronic pulmonary edema. Maintain the stress factors, neurological factor, tension, depression, anxiety, neurosis, hallucinations, etc. These are all neurological complexes because these produces specific chemicals which also damage the walls of the air sacs and the capillaries, and they also produces the accumulation of the fluid in the air sacs. So this disease is a medical emergency in case of acute, because the necessary item, the oxygen which is vital for the life of every living creature, especially in the human being. Oxygen is necessary for the function of every organ of the body. So, in this disease, the percentage of the oxygen in the arterial blood is reduced, due to which the life cycle is threatened. So, it is a dangerous one. It should be immediately handled and treated on emergency grounds.